and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for students. Today we're going to be talking about leukemia. What is leukemia? What are the types of leukemia? What are the causes of leukemia? The pathophysiology, the signs and symptoms, the management of leukemia, and also the nursing diagnosis of leukemia. By the end of this class, you should be able to answer this question. But before we go into details, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier said, today we're going to be talking about leukemia. When we hear leukemia, what should come to our mind is the cancer of the blood. The cancer of the blood. We are super and duper correct. But today we're going to be going in depth of what leukemia is all about. Leukemia is a fatal disease, it's a serious disease, it's a severe disease. It's a fatal disease characterized by an excessive, uncontrolled production of leukocyte. It is characterized by an excessive, uncontrolled production of leukocyte. And you know that the leukocytes are known as the white blood cells. In leukemia, there's plenty white blood cells. There's uncontrolled production of white blood cells. And the funniest thing about these white blood cells is that they are immature. Premature white blood cells are being produced. So when they are premature, they are immature. The white blood cells that are being produced are unable to carry out that function of defending and protecting the body. And also, when there is increased production of these immature white blood cells, there's going to be a reduced production in the red blood cell and the platelets. You can see leukemia is really the cancer of the blood. That takes us to the types of leukemia. Basically, there are two types of leukemia. We have the myelogenous leukemia and the lymphocytic leukemia. I will explain how these names came about. Looking at the production or the production and development of the white blood cells, you see that some white blood cells are developed from the lymphoblasts, while another type of white blood cells are developed from the myeloblasts. So when it's the lymphoblast aspect that is being affected, we say that lymphocytic leukemia has occurred. But if it is the myeloblast aspect that is being affected, we say that the myelogenous leukemia has occurred. So that is where they got their name from. It's actually the production of the white blood cells. Under myelogenous leukemia, we have two types. We have the acute myelogenous leukemia and the chronic myelogenous leukemia. In terms of acute, whenever you hear acute, what should come to your mind is that it is occurring quickly, fast. But in chronic, it is occurring slowly, slow and steady. But in acute, it is occurring quickly. So acute myelogenous leukemia, it's common both in children and in adults, and it occurs what? Quickly. And the second, chronic myelogenous leukemia, occurs slowly, and it is common in adults. Then the other, acute lymphocytic, now under this lymphocytic, acute lymphocytic leukemia, it is common in children, and it occurs what? Quickly. Then chronic lymphocytic leukemia is common in adults, and it occurs slowly. So whenever you hear acute, quickly should come to your mind, and whenever you hear chronic, slowly should come to your mind. So those are the types of leukemia. Then that takes us to the causes of leukemia. In terms of the causes of leukemia, it is idiopathic. The cause of leukemia is idiopathic. What do we mean when we say idiopathic? When we say idiopathic, we simply mean that the cause is unknown. We don't know what is causing this leukemia. But there are certain factors that are associated with the presence of leukemia. We have exposure to radiation, excessive exposure to what? Radiation. We have infection agents such as your viral infection, immunodeficiency. We have chemical agents such as your benzene, your methylene, all those chemicals. Then we have genetic variables such as your Down syndrome. Then that takes us to the pathophysiology of leukemia. In terms of the pathophysiology of leukemia, the key points or the key facts you need to know is what is written on the board. The first is there's increased production of white blood cell. And that increased production of white blood cells leads to the decreased production of red blood cells and the platelets. The increased production of white blood cells leads to the decreased production of the red blood cells and platelets. And the funniest thing, like I earlier said, there's production of what? Premature white blood cells, immature white blood cells. The white blood cells are not matured enough. And when that happens, that is going to impair the body's defense. The body will not be able to fight infection. The body will not be able to fight bacteria. And that makes this person to be at risk for infection. And also, because of the production of plenty immature white blood cells, there will be anemia. Reduction of red blood cells. There will be what? Anemia. And we all know that anemia is a reduction in the red blood cell count or the hemoglobin count. And because of that same production of immature or premature white blood cells, there's going to be thrombocytopenia, which is reduced platelets or thrombocytes in the body. And when there's reduced platelets or thrombocytes in the body, there's going to be hemorrhage. This patient is going to be any small thing you see bleeding, any small thing you see this patient bleeding profusely. So there's going to be hemorrhage. So these are the major things that takes place during leukemia. And that now results to the signs and symptoms of leukemia. The first here is fever. These cancerous cells are sending signals to the body that there's something wrong. So that leads to what? Increase in body temperature. There's malaise. This patient is easily fatigued. It's easily tired. So there's malaise. There's tachycardia. There's increased heart rate. That increased heart rate is as a result of the heart trying to see how to compensate for the reduced red blood cell count, for the reduced hemoglobin, to see that the body gets enough oxygen and blood cycle flow. Then the other is loss of appetite. Definitely, if there's loss of appetite, what do you expect next? There will be weight loss, right? There's loss of appetite, there's pallor, there's shortness of breath. Remember, there's no oxygen, there's little oxygen, and there's little oxygen in circulation. So there's going to be shortness of breath. There's bleeding gums. You know why now? Because of this thrombocytopenia, reduced platelets in the body. There's epistaxis, bleeding from the nose. The patient bleeds anywhere easily. Then there's pain in the bones. There's headache. The pain is as a result of rapid proliferating cells. The cells, you know when something is fast, the pressure from that production leads to the pain in the bones, leads to the headache. You get now? So these are the signs and symptoms that are likely to come up in a patient having leukemia. Then that takes us to the nursing, diagnosis, and management of leukemia. Talk about the nursing diagnosis, our work, our roles, our own diagnosis. The first one I have here is ineffective tissue perfusion related to suppression of normal blood cells evidenced by pallor or cyanosis. Ineffective tissue perfusion simply means that the tissues are not getting enough and adequate oxygen. The tissues are not getting enough oxygen. Why? There's decreased red blood cell counts in leukemia. So the tissues are not getting enough oxygen. That is why we're using this nursing diagnosis. Ineffective tissue perfusion related to suppression of normal blood cells evidenced by pallor or cyanosis. Cyanosis simply means bluish discoloration. Then the second nursing diagnosis I have here is acute pain related to rapidly proliferating cells in the bone marrow, evidenced by patient's verbalization. In terms of this acute pain, it's as a result of rapidly proliferating cells. You know, the production of white blood cells is very, very fast. They are producing it very, very fast. So that pressure with which they are producing it in the bone marrow actually results in a back pain, in a headache that this patient might be feeling. The other one I have here is risk for infection related to immature production of white blood cells. Remember when we were discussing about the leukemia, we said that in leukemia there are production of immatured white blood cells. There is a production of what? Immatured white blood cells. And these immatured white blood cells are unable to defend the body. They are unable to protect the body. And that results in this nursing diagnosis. These patients are at risk for infection. Then that takes us to the management. Generally, as a nurse, when it comes to management, the first thing that should come to your mind is you have to carry out assessment, proper assessment of the patient by taking data, hearing their previous health histories, taking past, present, and previous histories. As a nurse, you just have to take history anyhow. Just try and get useful information that will help you make the wonderful diagnosis. So you have to assess your patient thoroughly. Then the first here is relieving pain. In leukemia, this patient is having severe pain. So you as a nurse should take into consideration relieving this patient's pain by giving prescribed analgesics, providing hot or cold compress, providing diversional therapy can go a long way to ease the patient's pain. Then the second one we have here is ensure proper breathing pattern. This patient is likely going to have difficulty in breathing. This patient is likely going to have ineffective tissue perfusion. So it's your duty as a nurse to ensure that this patient is breathing properly by positioning this patient in the right position to ensure that the diaphragm is not lying on the lungs, to ensure that the diaphragm is well positioned and the body is well positioned to ensure breathing at that particular moment. Then the third is the vital signs. Vital signs cannot be underestimated. The patient's vital signs has to be taken because we as a nurse, these vital signs serves as fundamental. They serves as important data. So for the patient with leukemia, we have to take their vital signs, especially the temperature and the respiration. Then the other one I have here is hygiene. Personal and environmental hygiene should be explained in details to this patient, and while in the hospital, personal and environmental hygiene should still be taken into consideration because these patients, they are predisposed to going down with infection. They are at risk for infection because their immunity is no longer strong. Then the other one I have here is aseptic technique. As a nurse, whatsoever invasive procedure you are going to carry out in a patient with leukemia, ensure that it's in an aseptic technique to avoid the invasion of microorganisms. Then the other one, in terms of the drugs, we have corticosteroids. Corticosteroids are anti-inflammatory. They will be very, very useful in the treatment of leukemia. Then anti-neoplastic, they help to fight cancerous cells. We have analgesics, which serves as pain relief. We have antibiotics, which helps to fight infection. Blood transfusion can be given depending on the state of the patient at that particular moment. Then surgical bone marrow transplant. Surgical bone marrow transplant, it's actually a treatment, should I say a permanent cure now, for leukemia, in the sense that the bone marrow is being replaced by a healthy and fresh bone marrow that will be able to produce matured white blood cell. But the fact about bone marrow transplant is that it's very, very difficult to get a compactable bone marrow to actually fit well for this patient, and it is also very, very expensive. So surgical bone marrow transplant will go a long way to help cure leukemia if they can get compactable bone marrow and if they have enough funds to carry it out. Then in general terms, generally, when it comes to leukemia, the prognosis is usually poor, especially the chronic leukemia. The prognosis is actually poor. Most patients tends not to live up to 5 years before they die. That's 5 years from the day they were diagnosed of having leukemia. So the prognosis of chronic leukemia, it's actually poor, but the prognosis of acute leukemia, it can be treated with some medications. As time goes on, the patient bounces back to normal. But with chronic leukemia, you have to just manage and control the signs and symptoms you are seeing. Thank you very much for staying tuned. Thank you very much for listening. If you have any question, kindly drop on the comment section. If you have any contribution to make, or you have anything you would like us to discuss, kindly drop on the comment section. Don't forget to click on the subscribe button, turn on the notification button so you don't miss out. Thank you very much.